Hi, everyone. Thanks again for joining us today for our webinar, New and Efficient Patient Engagement Solutions from Ocean. We will be muting this webinar today, so if you do have any questions throughout the conference, please feel free to ask them in the Q&A section, and we'll do our best to get to them before we finish up. To ask a question, select the chat button center of the icons on your screen, and then when asking questions, ensure that you select to send to all panelists. I'm very excited to introduce you to Victoria and the Ocean team. For those not familiar with Ocean, they are a telehealth partner offering low-cost EMR add-ons such as online booking, patient forms, and check-in kiosks. Over to you, Victoria.
Great. Thank you so much, Patrick. And thank you to everybody who dialed in today for taking the time to learn a bit more about where we're at with the Ocean platform. I was looking at some of the names that have been dialing in as you've been signing in, and it's definitely a big mix. I know a lot of you personally, I know a lot of you as clients, and there's a number of you who I think are not yet using the Ocean, so a real range of users listening to us today. I'm going to give you a bit of a heads up about what to expect. So I'm going to introduce myself first of all. My name is Victoria Badgley, and I work here with the marketing, sales, and biz dev side of things. And I'm also introducing my colleague, Dr. Doug Kavanaugh, the co-founder and medical director here at Cognizant MD, who will be handling the live demo portion of today's presentation.
Hi, everyone.
So to begin with, we're going to just start out with a bit of an overview just to make sure everybody's up to speed on what the Ocean platform looks like today, because it really has evolved over the last 6 years. We're constantly adding features and even products, and so it's a much broader product suite than it was a few years ago. And even for some of our existing users, I think you're going to learn a few things today, possibly even about solutions that you're already using. So we'll cover off an overview of the platform. We'll talk a bit about some of our differentiators, why clinics are using Ocean and how, what the benefits are there. We'll do a very brief introduction to the demo that you're going to see, basically just outlining some of the highlights that we want to make sure that you don't miss, because even if you think you know a product, I think you may see some things that you haven't seen before. So please do stay on the line even if you are an existing user of the product. We'll then run through the demo, and I'll pass that off to Doug, and he will show you how it works in action. And then we'll close out with just walking through the pricing and answering any questions. I know that we expect to get questions throughout the presentation. We will, where appropriate, jump in and answer them real time. But if we don't get to them as soon as you ask them, please know we are watching them. And if we don't get to them at the end, at the Q&A, we will definitely reach out to you individually to make sure all your questions are answered. So with all that said, I want to just introduce the platform and tell you what it looks like today. So really, after 6 years in the market, Ocean really is Canada's leading patient engagement platform, and that is true in so many senses. The vast library of forms that we've built up is larger than any that we believe in the North American market, possibly anywhere. We have over 4,000 clinicians using our technology, and every day 10,000 or more forms are being completed by patients across Canada. And again, everything we do, we build for Canadian docs, for Canadian workflows, and for Canadian healthcare system. So to understand Ocean and really what makes Ocean a different solution than other patient engagement solutions that you may come across, you really have to start with forms. The whole product has been built upon a forms engine, and that does a couple of things. First of all, it makes it a vast library, a resource that you can access the moment you turn on Ocean. You have access to this crowdsourced series of forms that you can then go ahead and edit and turn into your own. But it's just a really valuable resource from the get-go. So that's step one. But the second piece about forms being critical to the way we do things is the customizability and flexibility that they give us, both in the kinds of questions and the kind of content you might want to collect from your patients, but even more than that, just in terms of how you want to display things, how you want content displayed in your chart, or how you want a online booking workflow to work out. Because everything is done through forms, we have a high degree of customizability. Today, the Ocean platform has expanded from its beginning as really patient tablets handheld in waiting rooms, right through to a full patient engagement platform that has the opportunity to engage with patients really at every step of the patient journey. So whether that's a patient completing a form, sending in a message to you through a form that's sitting on your website, whether they're booking online, or receiving an appointment reminder automatically on their phone with a form attached that they need to complete prior to their visit. When they actually get to the clinic, they can engage with a check-in kiosk to manually check themselves in and change their status in the chart or in the schedule. And at that point, they can also complete some other forms like a demographic review. And then in the exam room, they may again engage with a handheld tablet, this time possibly to complete some more clinical forms. And then finally, after the visit, there's more opportunities to engage with patients through automated messages or manual messages, surveys that you might send the patient. Patient-reported experience surveys are a great example of that. So when we ask our clinics that are using Ocean today, what are the things that you like best? Like, how is it that Ocean is changing what you do? There are really 4 key areas that we hear over and over again repeated to us. The first is pretty obvious, and I think most patient engagement solutions are addressing the left blue angle. So helping admins and saving time. I think that's core to everything. And we're doing that in multiple ways, whether that's simplifying the intake process by allowing patients to do it digitally and have it flow straight into the chart. Your staff members aren't retyping their address, trying to read illegible handwriting. All of that's taken out of the mix. Patient self-booking, so online booking, that's fewer phone calls for your staff. It's a simplified process. Patients and staff both love it. And then again, with patient check-ins, allowing your patients to do that independently really is a time saver for your admin team again. We're also doing a lot of work, and this is probably a less known area of where Ocean is really moving the needle, but around screening and quality improvement programs. Increasingly, we're seeing clinics model off one another to do things like universal smoking screening, fully automated, maybe at a kiosk or on the tablet, where that's updating the risk factor in the chart. And it can also then trigger other questions for the patient to try and get them into a smoking cessation program. So automating that program through Ocean, and in a way where you're taking what somebody else has done and just following that path. So lots of best practices there. Flu shot screening is another great one. So setting it up so that, let's say, from November to February, we want to screen our patients that are 65 and over, and we want to invite them to the clinic, flu shot clinic that we have coming up. So lots of screening opportunities. And then finally, prems and proms. We're seeing in Ontario, we've got a large number of clinics doing patient-reported experience measures, but patient-reported outcome measures amongst specialists are increasingly popular, particularly with our studies. So I will move into benefits and what we hear from the clinician. Charting being faster and more complete, and I think that's where, Doug really, where things started for him to a large extent, but still to this day, the tablets or patient forms being sent to a patient in advance are allowing clinics to collect a history more quickly. They're allowing that to be in the chart before the physician talks to the patient. It's more comprehensive. Scores are being calculated automatically, things like the PHQ-9, which I think is our most popular form, automatically seeing that score and red flags jump out for you. And then in our with our specialists, we're seeing lots of specialists use Ocean forms to auto-generate and create a consult letter so that there's very little left for them to do at the end of the day. And then finally, the reason we're all here really around improving patient care and the patient experience. And there's a number of ways we're seeing that happen. But first and foremost, it's around enabling them to directly contribute to their chart, really, and their care. So Ocean is also providing more ways for patients to communicate their concerns to their providers, and that we see leading to better care, whether it's somebody with mental health concerns who doesn't feel comfortable sharing things on a one-on-one interview, but they do feel comfortable expressing them on a tablet. And the studies have shown that out time and time again. And then finally, fewer no-shows. By making it easy for your patient to book online and then allowing them to be reminded with the details for the appointment, we're reducing the no-shows and making sure that patients are actually getting to the appointments they need to be at. So we're about to jump into the demo, which I know you're all here for. A couple of things I just want to make sure you don't miss today. Obviously, the online booking, I think there's a number of people who were definitely keen to see that, so we'll be showing you that. Website forms, if you haven't thought about those before, it's a really underused tool that can be super powerful, placing an Ocean form right on your website to allow patients to complete it at any time. The reminders will show you what that looks like, and just a reminder for you, those can be used before or after an appointment, which is useful for things like the patient experience survey. Check-in kiosk, if you haven't seen it before, it's a great way to automate and streamline that check-in. And remember, you can build in your forms, add those rule-based forms as you like at the check-in while screening them, and of course getting them to update their own contact info. Patient messages, this is a big one. Lots of people aren't aware of this. Some huge improvements to the way you can attach chart items to a secure patient message. So they're going to show you today, Doug is going to show you the green bar and how that automatically creates the attachment that then you can fire off to your patient, whether it's a results or a lab requisition. It's a super powerful tool. And then finally, Ocean Studies. Hopefully you're somewhat aware of Ocean Studies, but they're a really great thing to be aware of just as an addendum to all the patient engagement stuff. So the ability to collect information in aggregate for research or for survey purposes, and Ocean just makes that really easy. So I am going to pass that off now and hand the keyboard over to Doug.
Great, thanks, Victoria. Thanks everyone for your time today. We're really excited to be here, and again, I know how busy lunch can be, so we're going to get to the good stuff now. Victoria gave a great overview of the platform. I just want to sort of highlight a theme there, which is that we are very much in the business of improving the patient experience, but always concurrently improving yours as well. We know how busy you are, and we want to save you time. We want to make things easier. So I'm excited to be demoing some new technology today, as well as some of our classic bread and butter Ocean stuff. The first thing we'll be demonstrating is the website forms. So this is what Victoria mentioned earlier. It's a capability that allows you to put any form on your website. So think about your patients who have complained about calling in and not getting a hold of a receptionist, or difficulty leaving voicemails or hearing back from voicemails. I think we've all heard that at some point as clinicians. This is a potential solution. So if somebody is having trouble renewing a prescription or canceling their appointment, you can put a form on your website to handle that, and it gives you a very nice professional response when you do hear those complaints. There are so many things you can do with this. One of the most popular uses is a new patient registration, which is what Melissa's demonstrating here. So you can see on your website there is a way for new patients to register. In my own clinic, I do something similar. I have a waitlist application, a very simple form that they fill out, and they go directly in the queue from that point forward. So you can embed these forms or just have them accessible as public sites. If your website is not fully baked, you can still use this technology. It's really up to you. One of the nice features about website forms is that, as Victoria said, it takes advantage of our core forms library. So it leverages some of the work you may have already done developing forms. without requiring any sort of patient registration. So patients don't need to maintain a login or password when they're filling out a website form. They just go to your website. That's pretty much the only thing you have to tell patients, and they can pick up from there. Okay, so we're going to move on to the next product. This is one I'm very excited about, online booking. We've been working closely with TELUS on this for the past 2 years. We know it's very popular. I launched it in my clinic this past year, and the feedback's been wonderful. Patients absolutely love it. The front desk loves it. It's convenient, it's flexible, it's configurable, it has restrictions so that patients are booking the way we want them to book as well as the way they would like to book. So we're going to proceed now. This is a typical demonstration form. You can have the online booking open access, so a sort of walk-in style where even patients who haven't been to your clinic before can book. But more commonly, in a family practice clinic or specialist clinic, you will have patients who are registered and you only want those patients registering. So you can do that very easily. In addition, you can ensure that patients are booking under their own provider. So you can set up restrictions to say only Dr. Smith's patients can book for Dr. Smith. However, it's extremely configurable. You can set up rules to say if somebody's booking an immunization form, then they're also capable of booking with the nurse, or perhaps only capable of booking with the nurse in that context. The nice thing is it's all dependent on a form. Now, we have pre-built forms for you to make this very easy if you don't want to worry about form configuration. But you can decide what types of visits here patients can book. You can decide the rules under which they can book, the cancellation rules, you name it. We know that if we don't give you the restrictions you need, online booking can create more troubles for you than it solves. So we take that very seriously, and we built in that technology. For example, in this case, we're going to choose a mental health visit for our patient, Holly. And she's signed in already. Well, she's in the process of signing in here with her health number, her birth date, her first name and last name. Those fields are used to ensure that with a reasonable degree of confidence, she is who she says she is, which grants her access to the schedule. You'll note that she didn't have to call in because she forgot her login and password. She's just right here on the online booking form. She could have done this on her laptop here, or she could have done it from her cell phone. So this is mobile friendly, just like our website forms. It lays out very nicely, and patients can just pick up right in much the same way that we're proceeding here. The schedule shown here is somewhat restricted because it's meant to be. So we've set up the online booking just like in my clinic to allow bookings a day in advance, but no more than 14 days in advance. That's up to you. You can allow same-day bookings if you want. You can allow them to book farther in the future, but we just default with this setting to ensure that your schedule doesn't fill up 3 months from now when you're going to be on vacation. So here we are booking a convenient time. Holly can proceed from here. She's booking an appointment. Right now, in real time, it is booking into Practice Solutions. So there was no need to take this submission and have your receptionist enter it in the schedule. It is right there right now. And you can rest assured that the slot that was presented was indeed available. So even if your receptionists, your secretaries are booking into your schedule at the same time, Ocean does its very best to ensure that there are no double bookings and to ensure that the available slots are the ones that are indeed available according to your schedule. Now, to highlight the power of our form technology here, what we've done is we've shown how the post-booking form, so we call this the post-booking form because the booking is done. They're in the schedule. However, it's a great opportunity for patients to contribute to their upcoming visit. So in this setup, we've booked a mental health visit, if you recall, and that has cued Ocean to show the PHQ-9, the popular depression screening tool, automatically prior to the visit. Now, of course, this is the very same form that's used very frequently on our tablets and through our online messaging. But hey, it's here, the patient's sitting in front of the computer. What a great opportunity to collect that information up front. I think of this as a sort of line of defense analogy. I hope that gives its due respect to patients, but I like to collect this information as early as possible to minimize any intervention of yours truly or our office staff. So when the PHQ-9 is finished, we'll do that in a second, that is going to go directly into the chart. So it's a great way to get that part of the visit out of the way so that when you walk in as the physician or some other clinician, you have that information available. I glossed over the part on top here, forgive me, that explains when the appointment was scheduled, as well as this email confirmation button. So patients are free here to add the appointment to their Google Calendar if they so choose, or print a confirmation. Some of my older patients like to do that, I find, or email one to themselves. Now that email we just entered here. However, the email can come from the chart. So this is an example of a patient who hasn't provided email consent, but Ocean is capable of taking that email that's already been obtained, perhaps through an Ocean tablet, for example, or the kiosk, and making use of that. So from there, patients will receive an email where they can review their appointment again, cancel the appointment if permitted, and carry on from there. Okay, so you can see the confirmation, the email being sent. Even at the bottom, there's a little survey. So speaking to Ocean's patient experience survey and quality improvement capacity, it's just another opportunity for Ocean Forms to provide you with more tools for improving the patient experience. So that's a typical online booking. We're going to show you now here the schedule, exactly how it appears. So this booking reflects the duration of the mental health visit as configured on the booking form, so 20 minutes, or was it 30 minutes, sorry, no, 20 minutes, sorry. And it can be configured with the appointment type as well as a configurable detailed description of the appointment there. Now you can in fact set up your schedule in much the same way you're doing now to block off certain appointment times. So if you don't work on Wednesday afternoons, it's very easy to block that off. If you happen to be free on a particular Wednesday afternoon, you can reopen that. So there are all sorts of ways to, on the fly, update your schedule for the online booking. Okay, so now we just want to highlight another nice feature for Practice Solutions. So you can configure online booking settings for an individual patient. We were asked this quite a bit. Some patients are a little more high needs than others. We all tend to think of a few when that comes up. You can actually disable online booking entirely for these patients, or at least ensure that they're only able to book, say, once a month. So we've given you that capability with a really easy to use custom form in the patient's chart. You can ensure that if the patient has higher needs, or perhaps there's a language barrier, that the appointments, even if they were only 20 minutes otherwise, could be 30 minutes to ensure you have adequate time to communicate. Also in the chart here, you can see that PHQ-9 that we filled out, complete with the patient's answers and the score. A perfect score in this case. This patient is definitely not depressed. So the PHQ-9 at the bottom there, you can see PHQ-9:0. That's a custom vital in PSS. If you're not familiar with that term, don't worry about it. It just means that you can graph that value, you can search for it, you can create reminders that queue on it, you can use it for quality improvement, research, etc. Very handy. In addition, if there were red flag answers, so if the patient indicated that they were having suicidal ideation, you could see that in the note highlighted in red as well. Okay, so we're going to be carrying on and moving on to our next feature, patient reminders. Now, reminders are a wonderful way to not only reduce no-shows for your clinic, but include another line of defense, if I can use that term, to collect information from patients in advance of the visit. So with Ocean, our email-based form reminders will automatically send out, and you can configure the rules so that it's only sent for a particular provider or for a particular type of appointment, and you can set up multiple reminders. These rules can be configured to include forms as well. So if it's a mental health visit or diabetes visit, you can have a form specific to that visit to collect that information. And when they confirm the appointment, directly within the appointment schedule, we'll show you this in a minute, that little green circle showing that they've confirmed will be set. As a basic security measure, we just ask patients to enter their birth date. You can configure this if you like, but that's just to ensure that your email on file is indeed going to the correct patient. Once that's entered, you can see that the patient will, again, on their desktop, machine, or mobile device, see their appointment date and time. And from there, automatically it's been confirmed. From there, as I mentioned, the form can collect additional information. In this case, it looks a bit like the PHQ-9. This is the G87. And the G87 is a validated screening tool in the public domain that will also generate a similar score. So having the PHQ-9 and G87 gives you a really good sense of the severity of a patient's symptoms with regard to anxiety and mood. It's up to you what forms you want to use. So I often combine this with a focus history form to delve a little deeper into their mood-based symptoms, perhaps asking about alcohol or drug use and so on. From here, we've completed the questionnaire. Again, those answers will go into the patient's chart automatically. In addition to the pre-visit form, you can actually configure Ocean to send out patient experience surveys. So this is a really popular use of the platform as well. So, sorry, there's just something beeping on our line here. Okay. The patient experience surveys can be configured to go out after the visit. So reminders can send forms before the visit and experience surveys after the visit. And these can actually take advantage of HQO's standard patient experience survey, for example, or they can reflect your own family health team's patient experience survey. Now, back in the appointment schedule, you can see the little green circle as I promised earlier. So I use this in my own clinic, and it's really done a great job of reducing no-shows. We've had a number of positive reviews from patients. So we're going to move on now to our next product, the check-in kiosk. The kiosk is a variant of the tablet, if you will. So it's sort of like a different face of the same coin. You can have a kiosk mounted in your waiting room, either as part of a stand-up model or a countertop model. And it's designed to take some of the load off reception. So, of course, your receptionists are doing very important work, and it's not meant to replace them, but it does give you another option if they are overloaded, if they're on the phone, if your one receptionist has to go to the exam room as a chaperone. Ocean's kiosk can be right there, displayed for patients so that they can comfortably walk up and check in, either with their health card, so they can simply swipe their health card, or they can key it in like this. And from this point forward, they can proceed to review the clinic policy. So you can configure your clinic rules. You can include announcements here, advertisements for your clinic services, whatever you like, in addition to our privacy disclaimer. The patients do a little additional validation by entering their birth date. And from that point forward, the sky's the limit. So you can show any series of forms you want. The most popular, I would say, to show first would be a simple demographic form like this. So this is the time at which patients can review their contact information for your clinic and make appropriate corrections if necessary. So if their phone number is out of date, they can make a correction here. And as you might imagine and hope, any changes made here go directly into the appointment schedule or the patient chart, exactly where they should go. It's a great opportunity to collect office policy consent, as you can see here, so third-party examinations, travel medical visits, that sort of thing, in addition to email consent. So with Ocean, we've been able to collect email addresses and consent for over 90% of our patients. And that has just been transformative for our practice. It's been wonderful. And it would have been way too much work to do it the old-fashioned way with a paper-based clipboard. Just like the other Ocean forms, the answers go where you would like them to go. So the email address here will go into the patient demographics, and the email consent will be documented in the chart using one of those custom vitals I mentioned earlier. And those vitals, again, can be used for reminders. So if we have time, we'll show you the email consent toolbar, an optional Cognizant MD tool that allows you to more easily track which patients have provided email or voicemail consent. This is another, timely example of what you can use the kiosk for. So screening and population-based interventions. Flu season is upon us. Things are very busy now. It's a lot of work to keep up with not just patient demand, but our own demands for documenting flu status for performance bonuses and so on. Ocean can make your life much easier in this regard. So we can key in on the chart to see whether somebody's already had a flu shot. Thus, we don't bother them with this questionnaire if you already have the information you need. If you don't, as you can see with this form, which is configurable like all of them, it clarifies when they had it. So many patients now get the flu shot at the pharmacy. That's great. We just need to know and document it. If patients haven't had the flu shot, you can have some information that clarifies myths like the fact that it doesn't cause the flu. And you can have a soft commitment from the patient to receive it today. And you can set up a directive if you like to have your nurse give it from this point forward. So all of a sudden you have an opportunity to have your patients vaccinated with very little manual intervention. These screening forms can be used for all sorts of things. Flu shots, smoking cessation, Ebola screening was one clinic's use, which was very useful during the scare a few years back. It's up to you. And then, as you can see here on the final screen, there's a little closing off message. At this point, if the patient were to walk away early, they would be able to rest assured that their session will close automatically. So the privacy concerns have certainly been addressed there. But it still gives you an option whenever it's appropriate to have patients go to the front desk. So you can configure the kiosk to have certain criteria where patients can't use the kiosk. They need to go to the front desk. I'm sure you can think of some examples where you would like them to talk to the receptionist in person, and that's a very common workflow that we support. And that is the kiosk. You just want to go to PSS, the schedule, to show you what happens here. You can see the up arrow. That means they have arrived. So this is one of the most important features of the kiosk, is to actually know that they are there now, sitting in the waiting room. So for particularly busy clinics, this can be a lifesaver. So now we are going to segue into Practice Solutions to demonstrate some of the great EMR-specific features we have for Practice Solutions. Ocean has this very convenient toolbar accessible directly in the chart. This is a launching point for all the features that you might want to take advantage of within Ocean. At the very top is an optional toolbar, the email consent toolbar that I mentioned. So you can see very clearly that no email consent has been provided. If there's a manual consent process, you can simply click some buttons there. Otherwise, it's updated automatically. Below that immediately is our Ocean toolbar. So you can see there are some buttons to launch into the Ocean portal, to email somebody directly, to add forms, and so on. Also that you can stay in the driver's seat directly within the patient's chart. Now what we've done here is we've green barred, I'm sure that's a term you're familiar with for the PSS experience users out there. We've green barred a lab result here. This is a feature we're particularly proud of. We think we do it exceptionally well. You don't need to print a file here or save anything to your desktop where it may be forgotten or stolen and thus create a privacy breach. Directly from the chart, you can click that note, click email patient. And sorry, we were sort of reusing the browser here, so we're just you can click email, and that will use Ocean's single sign-on process to bring you to the send message page. So you don't need to enter a login and password here. This is another crucial and key advantage of Ocean that we're quite proud of. The single sign-on process there saves you those precious few seconds that you're doing otherwise over and over throughout your day, and it allows you to use Ocean without a second thought. So when I'm working through my messages in the morning and a lab result comes in, I'm no longer intimidated by the workload of ditching the no news is good news paradigm. I've never liked that. I don't think anybody does. With Ocean, it's so easy to send lab results to patients, especially now that we've documented email consent, that I just go ahead and do that. So we've clicked email. The attachment is sitting right there, as you can see on the screen. And all I do is I pick a template that the results are normal. You can preview it if you like, if you're not sure what the patient's going to see. And then you just click send. And in fact, there are even keyboard shortcuts to do all this even faster. And then boom, you're done. You can move on to the next patient. You can imagine how quick that is. And that's been transformative for our users' practice. One of the reasons Ocean's so popular. Now, the patient from there is going to receive an email, similar to what you saw with the form reminders, where they simply check their email. They might enter their birth date as a simple validation and carry on from there. So they can view those lab results. They can answer questionnaires. Just like everywhere else in Ocean, the answers go directly in the chart, exactly where you need them. One last point. We didn't spend much time in the portal because in general, especially for the doctors out there, you don't need to go into the portal. It's only for these exceptional scenarios where perhaps you want to look at all of your overdue messages, or you want to configure your forms and so on. Directly from PSS, you simply click on Ocean, you click on Portal here, and then it's signing in automatically, as usual. And from there, you're directly in the portal. So this is where you can go to see your practice as a whole and what you've done with Ocean. It's a convenient way to export study answers, to view overdue responses, as I said, to review your website form submissions. It's up to you whether you want to be a little more hands-on if you're a physician and do this yourself, or whether you want to delegate to your support staff. The workflow that I find I don't usually do because it's quite mechanical, but it's up to you. So I think that concludes the demo. We can, from here, transition to the Q&A.
I think first we're going to cover off on the pricing.
Oh, yeah, sorry. Apologies, Victoria.
So obviously everybody wants to know what would all of this cost. So I'm going to walk you through very high level, big picture, what pricing for Ocean looks like. At the top line, what you're seeing is very simple monthly license fees for three things. So whether that's a tablet, a single handheld tablet, whether it's a kiosk, which is really just a tablet being used in kiosk mode, or whether it's a link on your website, so a website form link. All of those come in at $55 a month. There are no minimums, no contracts or commitments, so you can add and remove services as you like. And I should note that all your billing goes through TELUS, so this will appear on your TELUS bill regardless of what you're using here. For Ocean Studies, we have an unlimited plan. So what this allows you to do is have as many studies as you want and as many submissions as you want. There are no transactional fees, so that's $100 a month, and that's, again, unlimited usage. Once you get into patient messages, there are a couple of ways of using Ocean patient messages. The first and the most basic way is to have what we call a user license, so a patient messages user license. A user license does come with a delegate, so in actual fact, it really is 2 users, and we have some clinics that actually split that single user plus delegate amongst 2 admins, for example. So that's $30 a month. Again, no contracts or commitments, and that allows the staff members to be able to send as many messages to patients as they like. Messages are sent from the chart or from the portal, and they're sent on a one-off, so one-by-one basis. The next row in my chart covers off what we call our unlimited patient message bundle. So this is a clinic bundle, and it gets you really all the power of patient messages. So whether that's those individual messages, but also group messages, which some other people sometimes refer to as broadcast messages. So you get unlimited patient messages, unlimited group messages, and unlimited automated messages, which we think of as reminders. So sending an automated message before or after an appointment as a reminder. So that covers your whole clinic because it's a clinic bundle. And the way we price this, honestly, the best thing to do is to come talk to us and tell us what your clinic breakdown looks like, and we'll give you a quote. But we price this on a per FTE basis, so that would be not your admins. We're just looking at generally anybody with a booked schedule, so your physicians, maybe your nurse practitioners, possibly allied if they are booking directly. So price per FTE with a $100 clinic minimum, and it works out to $25 per FTE. But again, come talk to us about pricing because it's always best to hear it from us, and we can run the math. And then finally, online booking. Online booking is designed to be an add-on for our unlimited message bundle users. So it is required that you are licensed with the unlimited messages bundle before you can start adding schedules on online booking. So assuming you have that license in place, it's $25 a month per schedule. So you can start light and just have 1 or 2 schedules and then grow as you need. There is a one-time setup fee of $150. That is a single setup fee. It does not it's not for each schedule. It is a one-time thing to get you started. So again, $25 a month, and that would be per schedule. So that really covers off the pricing and hopefully gives you a good sense of what that looks like. If you ever do want to go back and take a look at or revisit our pricing, we do make it available at all times on our website at the link found at the top of the page, cognizantmd.com/pricing. So you can go there anytime to see what that looks like, or you can direct your colleagues there. So I do want to start throwing out a couple of questions. We've had a number of questions come through. We've been trying to answer them as they've been coming in, but I've got a couple outstanding ones. So I'll start with those and then take a look at any more that come in as we're chatting. So, Doug, there was a question around setting up multiple reminders. Can there be more than one for the same appointment? And then also, what happens if patients don't complete a form that's part of their reminder? Where does that form go?
So great question. You can set up as many reminder rules as you like, and each one can be configured to show a certain number of days in advance or a certain number of days after the visit. It can be configured to key in on an appointment type as well as other criteria. So you can actually set up reminders to, for example, send 14 days in advance and then 7 days in advance, as many as you like. Does that answer the question?
Yeah, that's great. And so if the form was not completed at first visit, when and how are you going to collect that data?
So you can use Ocean in other ways if necessary. So for example, you can have the tablet collect that same form if necessary. But it's important to realize that if you want a form to stay in the queue, it will remain there until it's appropriately completed. So it's not just forgotten. It's really up to your clinic policy to decide what to do with that.
That's great, thanks. So we do have a question around customizing of forms and building of forms, around who's responsible, can people do their own customization, what kind of support do they get? So I can jump in on that one. Basically, every Ocean user has access to all the core library forms. Those are the forms that we at Cognizant MD have uploaded into the system. And you can also access the much broader library of shared forms. You can import any of those forms into your own library so that you can use and access and edit them. And you can edit them at any time at no charge. I would say that looking at our current clients, about 75% of them do their own editing. We do have a form editor that makes it quite easy to make form changes. So you are free to do any changes that you like, and there are no fees associated with that. That's all built into the price. If you were working on a more complex form, we often recommend working with a third-party expert contractor who can pull these things together much more quickly. So if you're in that situation, just let us know, and we can provide you with a reference of somebody who can assist you. If you're somewhere in between where you're trying to build a slightly more complex form, we have a really great support team over here who's happy to take your support tickets, read the issue that you're having, and help work out if you're hitting a wall with your form. So really a few different options. I think the key is all of that is free for you to use and to play around with. And it's really only if you find that you need additional help beyond what standard support channel can get. At that point, you'd be looking at some fees, but otherwise it's all built in. So we also had a question around what does pricing look like if a physician wants to get, like, quote unquote, the whole package. And we get this question a lot around, do you bundle? Like, is there a bundle discount? And the very quick answer is no, we don't. We have worked really, really hard to keep our prices as low as we possibly can, and we've done that in a number of ways. Everything from the fact that we generally do not do sales on site. We try to do everything remotely. We have invested heavily in online resource databases that you can access yourself. So all of those things work toward us keeping our prices low. And so what we have chosen to do is be transparent with our pricing and not offer discounts. So you know that the price you're paying is what every other user is paying at any given time. So coming up on the roadmap as we continue to develop the Ocean solution, I'm going to pass that one on to you, Doug, to talk a bit.
Okay, thanks, Victoria. Our roadmap is chock full, I would say, of innovative new features. I don't know what I'm allowed to say, frankly, what I should. We continue to invest in the patient engagement system. I know we've been asked about SMS a few times, so we've certainly taken that into consideration. Perhaps you can list some other features too, but I can say that we continue to add incrementally to our core products. So the forms library continues to grow, and we're always interested in hearing more feedback about forms we can add or improve. That's come a long way. Our online booking is easily, I think, the most exciting product for me, especially with it in my own clinic. And we're making rapid enhancements to that with increasing configurability and other features. Is there anything you wanted to add to that?
Yeah, I think it's fair to say that we have some really exciting plans for making the user experience better in the portal. We know that most of the time you are in PSS, and that's great. We love the fact that you don't have to leave your core solution, but We've got some really brilliant minds on this side of things working on how can we make it easier to use, slightly friendlier to use, and along with that is going to come features. So I actually see 2020 as being a bit of a refresh year. We have a really broad stable of products, and I think it's going to be a year of just making them better. And so I think there is a lot to look forward to. As you say, SMS is a big one, and we're definitely heading down that pathway. And I think it's only fair to say as well that while it's not directly related to our patient engagement, there is an enormous investment being made on the e-consult and e-referral side of our business, which also hopefully has trickled down positive impact for all of our Ocean users. So keep an ear and an eye out for that as well.
Yeah, that's a great answer. I think refinement would be a theme. You know, we're adding features based on very popular requests from clients. But overall, we're just focused on making everything work better. There's always room for more.
For sure. And we're getting a few quite detailed questions coming in. I want you to know that any questions we're receiving, we're going to be following up directly with you to answer them if we don't answer them on this call today. There was a question about custom forms being built in PSS, and are they exportable to Ocean, or do they have to be recreated in Ocean? Great question.
That is an excellent question, one that we're asked very, very frequently. It's a different forms technology. So the forms that you build in PSS are often designed, not always, but usually designed to be completed by a clinician. It's in a proprietary practice solutions format. Much like a PDF. So it's not well equipped for Ocean off the bat. It needs to, for example, lay out nicely on a patient's tiny little mobile phone. So as a result, there's a straightforward process for porting those forms. Our visual forms editor is point and click. What you see is what you get with it. So many clients are comfortable just going ahead and copy and pasting questions from existing forms. And as you mentioned earlier, we have lots of tools to assist clients, including contracting options if desired. The nice thing is we have 4,000 plus forms. So there's a good chance there's something that either is exactly what you want or very close to it.
We have a question, and we get this one a lot as well, particularly in pediatrics. So a question around the SNAP-4 questionnaire, and how is it possible to have both the parent and the teacher complete it? What's great is we have a bunch of really, really creative pediatric clinics that have tackled this problem ahead of you, and there is a way to do it. I would ask to take it offline, but there is a very creative way. Ocean has worked with a pediatrician to build in a sort of a way of allowing the parent to forward the form once the parent has completed it to the teacher, and it all stays in the same single record, and the parent is inherently providing consent to the teacher to complete it. So we've got a number of clinics that use that approach. We're happy to walk you through it. So there's ways to get creative. Another question, around jumping back and forth. The pricing question, we can work with you directly. I think you've got it right there, but just want to do the math. The online booking rules, that was the other one I wanted to touch on. So good question from Jennifer about, can users customize their own online booking rules? And the answer is yes, but what I would say is that our current approach has a pretty heavy hand-holding in that setup phase. So we have a wonderful new staff member named Marielle who's overseeing online booking implementations, and she works with each clinic individually to understand what their needs are and then walk them through, here's how you would do that in the portal. So they're doing it themselves, but with a bit of hand-holding, with the idea that down the line, hand-holding won't be necessary, but it is all configurable right in our portal. So I know we're coming up. We do have a question about Ocean in Alberta. Definitely, is it being used in Alberta? Certainly, most definitely. We have a growing number of clients actually in Alberta and some exciting initiatives out there. I'm happy to talk with you more about that offline. So there is a question around, for big clinics, multiple family physicians, specialist walk-ins, is it better to go all under one site, even if there are multiple receptionists? And that is a question where there is no clear yes or no. If it's very large, we would probably say you're going to have a couple of ocean sites and divide it up and sync the providers for each clinic to that ocean site, even though you're all on one EMR. But it really is a question that is best addressed with a sales account manager who can understand exactly what your setup looks like and the degree to which patients are crossing between clinics and things like that. The most important thing to know is that you have the option to do both. So we can configure whatever's going to be most optimal based on your workflow.
Many components of Ocean scale up based on use. So that's another nice thing about the pricing. If you think about the kiosks and tablets in particular, you don't need to go all in off the bat. You can have as many as needed in your initial rollout to ensure that it's there when you need it, and then you can circle back and purchase more if necessary.
So Anna's asked us whether we have a patient portal coming, and the answer is no. At this point, it is not part of our philosophy or vision to build a static portal. We're seeing lots of portals come onto the market, and there's a lot of great players out there. You know, things like Sunnybrook's MyChart is expanding really rapidly. We see us being tied into those other systems at some point, maybe sooner than later. But yeah, no, we don't plan to build a portal. Doug, do you want to speak to that?
Absolutely, yeah. I think a lot of physicians have strong feelings about this, myself included. I think we're all in the business of helping patients, and we're in the business of helping you help your patients. And what we're doing is we're giving you online booking, secure messaging, everything you need. But we think, as Victoria says, that the actual patient portal component will be better served with a provincial system, and thus we just need to give you the tools to make it through your day easier and provide better care in the interim while this whole thing shakes out with the patient portal.
And finally, we've got 1 minute left, so I'm going to answer Jim's question around e-faxing. Can Ocean do e-faxing? And the answer today is no, but what we can do is, I mean, certainly you have e-faxing in PSS, so you really don't need Ocean to be doing that for you. So we don't see that as somewhere that we could add any value. But if you're in Ontario and you're interested in e-referrals, certainly happy to take that conversation offline and tell you a bit more about how we're playing a role in the Ontario Ministry's rollout of electronic referrals. I think that takes us to time. Patrick?
That's excellent. Thanks a lot, Victoria, and thank you, Doug. That was actually really, really engaging. You're right, there was a lot of questions, and I think we got through most of them. If we do have any further questions, please feel free to reach out to your TELUS Health account manager. I will also share them with the Ocean team afterwards so they can follow up with anything that needs to go into a bit more specific. We will be sharing a recording of this webinar with everybody who registered early next week. And again, I just want to thank you all for your time. Thank the Ocean team, and have a wonderful weekend.
Thank you so much.
Really appreciate everyone's time.
Have a great weekend.